One of the things I've noticed as we've been working on this project and sort of assessing the needs of the Watertown area is how many, is that a lot of the people who don't have insurance, it's not people who are unemployed or, are, sort of temporarily in the Watertown area. It's people who've lived here for a long time or have full-time jobs, just don't have jobs with benefits.
Lady, just the sweetest little grandma type you'd ever hope to find, living with her daughter, had never worked. She was a homemaker all her life and had no insurance, and they were just hanging out there till 65 years old. They knew when she was 65 that she'd be able to get all the treatment she needed. Her daughter had tried in every which way she could to try and find insurance for her mother and hadn't been able to. Well, there was one day she was just in her yard and suddenly started feeling this terrible chest pressure, and they took her off to the emergency room and she had a massive heart attack. She was in our office. They had been able to, at the hospital, take care of her, and she was now needing medication also with no means to pay. She had never been there before. She had avoided all care up to that point in time, and she was also crying. I have never taken charity care in my life. I don't know why I have to be here. Why doesn't our country provide health insurance? Why isn't there some other way for me to get it? And really, we are the only developed country in the world that doesn't provide health care for its citizens. And so we are putting some of our citizens in very, very awkward positions.
Traditionally, we see people who were unemployed or who aren't able to work. Now, I think you see society sandwiched between generations of taking care of children and parents and maybe not working because of that, or working and trying to get everything done and not being able to do that anymore. So I think there is a change in the face of the working class and how we look at who gets the medical needs met, or other needs as well, but medical needs in this case. So yes, working people without insurance have a real big problem. Without clinics like Rock River Free Clinic, we have a big question mark. How do we take care of those people?
Well, a year ago at this time, I found out I had diabetes type 2. And not only, well, it's kind of a shock, but the price of the medicine, I can't even afford it. So without the clinic, I'd be in pretty tough shape trying to afford it myself with no insurance. Well, I can't really afford it. The job I have, it's not all that well paying. He is a small business and he really can't afford it himself.
Anyone can find themselves in a desperate situation when it comes to health insurance. I had an experience many years ago where my wife contracted diabetes, and shortly after that my firm was sold and I went into private business. And her with a pre-existing condition, we could not get insurance on her. And so for a couple of years, we were in the predecessor to the Badger Care plan. And my fault, I was one day late with a insurance payment, or the, help me out, premium. And they canceled us. And so until I was elected as an alderman, where I could get under the city's insurance umbrella, I gave the city then for several years my entire alderman paycheck, plus added, I think it was about $200 a month. But at least we had the comfort of knowing that we had health insurance. So it can happen to anyone.
One patient I had recently that struck me fit this so well was someone who did not have the money to buy their medications. I could see them in my clinic and offer them medications from my cupboard, what I had, but I didn't have enough for their needs. And what I found was, by using one of the free clinics in the area, that patient could get the care they needed and the medications they needed, something I could not do for them by myself, because I don't have the resources. And so this patient, although I saw her periodically for health care, was able to get the best care possible by getting additional resources and testing done through the free clinic process.